Prevention over prescription: why nutrition education must start in schools. Across the globe, leading authorities like the World Health Organization continue to sound the alarm on rising rates of lifestyle-related conditions such as type 2 diabetes, obesity, and cardiovascular disease. Campaigns urge people to eat better, move more, and take control of their health. Yet, despite these well-intended efforts, one critical question remains: why does most intervention begin only after the damage is already done? The current model largely targets individuals who are already facing medical or psychological challenges. By the time intervention occurs, habits are deeply ingrained, metabolic damage may already be present, and the journey back to health becomes significantly more complex. While treatment and support are essential, this reactive approach overlooks a far more powerful strategy: prevention. The reality is simple: eating habits are formed early. Children are not born craving ultra-processed foods or sugary snacks; these preferences are learned. From lunchboxes to school tuck shops, the environment often reinforces convenience over nutrition. Yet formal education around food, what it does to the body, how it affects energy, mood, and long-term health, is surprisingly limited in most school systems. If we can teach mathematics, science, and language as foundational life skills, why is nutrition, arguably just as critical to lifelong well-being, treated as optional? There is a growing global shift toward healthier living. More people are becoming aware of what they consume, reading labels, reducing sugar intake, and questioning the role of highly processed foods in their diets. However, this shift is often driven by necessity, after a diagnosis, a health scare, or years of struggling with weight and energy levels. It doesn't have to be this way. Imagine a system where children are educated from a young age about how food works in the body. Not through fear-based messaging, but through practical, empowering knowledge. Teaching them how sugar impacts insulin, how real food fuels the brain, and how consistent poor choices can lead to long-term consequences. This isn't about restriction, it's about understanding. Equally important is the role of young and expecting parents. Early childhood nutrition shapes development in profound ways, yet many parents are left navigating conflicting advice and aggressive marketing from processed food industries. Providing clear, accessible education at this stage could have a generational impact. Schools are uniquely positioned to be the catalyst for change. By implementing structured, compulsory nutrition education, they can equip the next generation with the tools to make informed decisions. This is not about turning children into dietitians, it's about giving them awareness and responsibility for their own health. Of course, education alone is not the entire solution. It must be supported by environments that make healthier choices easier, both at school and at home. But without a strong educational foundation, even the best initiatives will fall short. The phrase, "prevention is better than cure," is often repeated, yet rarely fully embraced at a systemic level. True prevention requires early intervention, not in hospitals or clinics, but in classrooms. If we are serious about reducing the burden of chronic disease, the focus must shift. Less time reacting to illness, and more time preventing it. Less emphasis on managing symptoms, and more on understanding causes. Because the most powerful healthcare system isn't one that treats disease, it's one that teaches people how to avoid it in the first place. Disclaimer: this article is intended for general informational and entertainment purposes only. It is not medical advice, and it should not be used as a substitute for professional diagnosis or treatment. Always seek the guidance of a qualified healthcare provider before making any changes to your diet, lifestyle, exercise routine, or medication. Stay updated on the latest news, connect, interact, and more on KetoNet, available on the Apple Store and Google Play.